Hi, I'm T1J.
Follow me.
So I'm guessing you've read the title of the video and probably have already had your initial reaction to it, whether you agree or disagree. But in order to continue, we've got to define our terms. A lot of the disagreement on the issue of whether healthcare is a right boils down to pedantic debates about what a right even is. At its most basic level, having a right to something means either that you're allowed to do something or that something is owed to you. So you may have a right to express yourself freely, or you may have a right to a lawyer when accused of a crime. This also implies that the negative versions of these are true, namely that you are allowed not to do something. That is, you have a right not to be compelled to do something you don't want to do, or to have something done to you that you do not consent to. So you may have a right to remain silent when detained by the police, or you may have a right not to be assaulted. All of the examples I've given fit roughly into a legal framework of rights. And the concept of rights is fundamental to the law. In fact, the primary function of the law in modern democracies is to enforce and protect people's rights. And while there is global pressure for all nations to adopt equitable, humanist policy, ultimately each country decides what rights it legally affords its people. For example, in the United States, you have the right to publicly sympathize with enemies of the country or disgraced historical figures who are widely regarded as villains, like slaveholders or dictators. People might hate you for it, but you generally won't get arrested. However, in South Korea, the citizens do not have the legal right to sympathize with Kim Jong-un in North Korea. It's literally illegal, and they have arrested several people accused of doing so. It's not a one-to-one comparison, but hopefully you get the point. But the law is only one of several ways to conceptualize rights. Another way is to talk about natural rights. These are rights that people supposedly have from birth just by virtue of being a person. They are universal and independent of any laws or customs. They cannot be repealed or revoked. They are inalienable. Some argue that these rights are granted by a god, while others say that the very nature of humanity implies these rights. Perhaps the most famous concept that is proposed as a natural right is the right to life, which is to imply that it is immoral to kill or attempt to kill another human who wishes not to die. The problem here is we're getting back into moral philosophy territory. There have been many great discussions throughout history about whether or not natural rights or objective moral laws exist, and you should look into it. I think it would be enriching. But as I said before, it's hard to make sound arguments about fundamental moral principles. How can you prove that humans have universal, inalienable moral rights? And even if you could, how could you determine exactly what they were? You pretty much can't. You just have to make the best argument you have and hope it rings true in other people's minds. And it's hard to really go beyond that. So one other way we can discuss the notion of rights is with regard to social contracts. These are quite simply rights that we grant to each other just because we agreed as a society that it would be good to do that. So for example, instead of arguing that we have the right to life just by virtue of being a human, we come together as a society and decide that killing each other is kind of a huge bummer. Like we mostly all would rather not be killed. And we also generally don't like it when other people get killed. So let's agree not to do that to each other, and let's condemn or punish those that do. And of course, these socially mandated rights often but not always intertwine with or are the basis for legal rights. Murder is illegal in virtually every country, so that lines up nicely. These can definitely contradict though. In America, we have the legal right to bear firearms, and we sure damn do it. However, it's pretty much statistically demonstrable that our love of guns results in thousands of arguably preventable deaths of innocent people every year. So our agreement to protect each other's right to life has clashed with our legal right to bear arms. But that brings up another issue. While I'd say it's pretty clear that the right to life implies a duty to avoid killing each other, does it also involve a responsibility to protect each other from dying? Imagine you see a stranger crossing the street. They're on the phone, not paying attention. All of a sudden, a car comes speeding down the road and you can tell it's not stopping. Would you yell out to that person and try to get their attention in hopes that they could move out of the way of the speeding car? My guess is that most of you would. And if you didn't and the person was killed, you would probably feel bad. Correct me if I'm wrong. But the real question is, should you? That is to say, do you have a moral responsibility to do what you can to keep this person from being killed or severely injured? This is the strength of the social contract when compared to the law. As far as I know, it wouldn't be illegal in most places to neglect to say something to this ill-fated stranger. But in that moment, most of us would understand how potentially awful this situation is and spring to action. And we would want someone to do the same for us. So I do think that the social contract not only involves not directly killing people, but also doing what we can to prevent people who do not wish to die from dying. Now, I don't necessarily think that it should be illegal to fail to prevent someone's death. That seems like a potentially dangerous precedent. And I also think the law plays a role in certain cases where the social contract cannot. I'll talk about that a little more later. Now, of course, we didn't all meet in a convention center somewhere and come up with rules about how we should treat each other. Much of this social contract is implied and subconsciously adhered to. Most of the time, when humans are unsupervised and left to their own devices, they don't typically just run around killing and hurting and robbing each other. And I don't think it's because we're afraid of the legal consequences. I think it's because we don't want to. The idea of harming another innocent person is distasteful to most of us. This is partly because, as many studies show, humans seem to be born with an inclination towards empathy and caring for others. This behavior needs to be reinforced, however. Thankfully, it seems to be the case that most modern societies value compassion and empathy, which has helped condition our subconscious mind to react negatively to human suffering. This is also why I don't feel a pressing need to explain to you why you should be nice to people, because I feel like you probably already believe you should. Of course, people harm each other and do unkind things all the time, essentially breaking the contract, and this is unfortunate. But we also see time and time again that even if the law can't, society tends to condemn and ostracize the people that egregiously break the contract. And in my opinion, this simply emphasizes the fact that the contract actually exists. It's also true that moral inclinations are sometimes based on our political views, which can lead to disagreements about the details of the social contract. For example, some people may believe that abortion is a violation of the right to life, while some people disagree that the human fetus is in fact a person with rights. But that debate is beyond the scope of this video. I just want to emphasize that, like everything else, it's fucking complicated. So if we generally believe in a right to life, it is natural, to me at least, to extrapolate from that a right to some standard of good health. And again, I think most people want to be healthy, and I think most people have a negative reaction to seeing other people get hurt and sick. So once again, I believe we've generally agreed to not cause each other to get hurt and sick, and to condemn or punish those who do. And this is usually a legally protected right as well. It's usually against the law to cause people physical harm. But again, the question is, does this also imply a responsibility to do what we can to prevent people from becoming hurt or sick? If you recently quit working at a restaurant because you learned the cooks used diseased rats they found in the alley as meat for the chili, do you think you have a moral responsibility to, at the very least, discourage people from eating there? You'd probably want someone to do it for you. But when we're talking about health, it goes even deeper. With life, it's like either you have it or you don't, and there's not much crossing between the two states. But with health, there's something called health care. And adequate health care can cause your health situation to go from bad to good. And some people need adequate health care in order to enjoy their right to life, because they might die or suffer otherwise. I can't speak for other countries, but in the United States, we provide emergency health care to everyone who seeks it. If you show up at the emergency room, you will be treated regardless of your situation. You'll get a huge fucking bill later, but you'll receive health care. Why do we do this? Put another way, should we do this? If we fail to do this, are we doing something unethical or immoral? Some people argue that healthcare is a commodity and not a right, but what other commodity is guaranteed to people regardless of their ability to pay for it? It's bizarre to even say the words out loud. That don't sound like a commodity to me. And I think the reason that we care for people even when they can't afford to pay for it is because we as a society collectively believe that people deserve or are owed healthcare. And we want someone to do it for us. Former Congressman and famed libertarian Ron Paul was asked a few years ago if people who couldn't afford healthcare should be left to die. Paul himself gave a roundabout non-answer, but someone in the audience was very confident about their answer.
Are you saying that society should just let him die?
No.
And I suppose this is where the initial thought about fundamental moral disagreements comes into play. To me, saying that you should let someone whom you have the ability to care for simply die because they can't afford the treatment is thoroughly reprehensible. But I suspect that most of you watching this video wouldn't simply let someone die if you had the ability to care for them. Not merely because you just happen to be a nice person, but because you believe it's the right thing to do. Now, a lot of people might agree with the idea of the social and moral responsibility to care for others, but they might argue that this doesn't mean we should be legally compelled to. But laws, just like moral worldviews, are essentially a list of things we ought and ought not do, and are generally informed by what we inherently already believe as a society. In modern democracies, it's things like life and safety and freedom and privacy. I don't think those kinds of laws would exist if we weren't already an empathetic species. Law also, in theory, provides an impartial and organized basis by which to think about interpersonal conduct. And it also provides standardized recourse for disputes and rights violations. And some form of legal system also seems to be necessary to protect other kinds of rights that aren't particularly covered by the social contract. For example, freedom of the press is not specifically related to human empathy, but many countries have declared it a fundamental right. And I'm not sure how you sufficiently enforce that sort of right without legal and government protections. So yeah, in order for rights to mean anything in the grand scheme of things, there probably needs to be some kind of legal resource when those rights are being violated. Society can condemn and ostracize a murderer as much as they want, but this doesn't compensate the families of their victims, nor does it prevent them from committing more crimes. You need more organized justice for something like that. One argument I hear a lot from conservatives is that you cannot have a right to something that must be provided by someone else. This is supposedly a violation of that person's right to choose their own labor.
You have no right to demand medical care of me. I may recognize your necessity, I may offer charity. My friends and I may choose to band together and fund your medical care, but your necessity does not change the basic math. Medical care is a service and a good provided by a third party. No matter how much I need bread, I do not have a right to steal your wallet or hold up the local bakery to obtain it.
But this is an inconsistent argument. In America, one of our most fundamental rights is the right to a lawyer and a right to a trial by jury. Both of those things require the services of other people: the lawyers, the judges, the jury, the court reporter, and all the other staff. The right to vote requires the services of many volunteers and government employees. You can't just autonomously vote, you need other people to facilitate that for you. Most labor rights must be provided by someone else. Someone else has to provide you with safe and ethical working conditions. Someone else usually sends you your paycheck, and someone else has to make sure they pay you at least a minimum wage. So this idea that something can't be a right if it's provided by someone else is kind of a random and unprecedented argument. And again, this idea is contradicted by the fact that we provide emergency healthcare to everyone even when they can't afford it. So we already force people to provide medical care, usually on the hospital's dime. And as much as people argue against healthcare as a right, I don't think I've ever seen someone argue that hospitals should discharge or refuse care to patients who can't afford the costs, except maybe Ron Paul. I think it's because they understand that that would be downright cruel. Can you imagine walking into a car dealership and expecting to leave with a car even when you have no money? You'd be tossed out by security in a heartbeat because you don't have a right to any of those cars. You do, however, have a right to be cared for when you are hurt or sick. If you didn't, there would have been no incentive for the American Congress to pass the Emergency Medical Treatment and Active Labor Act in 1986, which is the law that requires hospital emergency care for everyone seeking treatment. Given that social organizing is clearly not adequate for enforcing and ensuring access to healthcare, we need some kind of legal recourse when this right is violated. So then you might argue, we technically do provide healthcare to everyone. You said it yourself. We just send a bill afterward that they likely aren't able to pay. Well, besides the fact that requiring someone to pay for something you know they can't afford is an idiotic system, burdening folks with tremendous amounts of debt and likely stress and suffering for simply pursuing something they have a legal right to pursue is, in my opinion, extremely unethical. But more importantly, adequate healthcare is more than just emergency services. It's primary care, it's preventative care, it's mental health services, it's reproductive health services, it's family and child care, it's access to drugs, access to health information, and much more. And in many places, including the United States, these services are not guaranteed to people, even those with health insurance. Because if your deductible is too high, then in some cases it's virtually the same as not having insurance. Many people have health insurance but still never receive care because they can't afford the out-of-pocket costs. And this seems to me to be an example of our right to a quality standard of health being violated. If you can't afford something, you do not have access to it. Now, can we just snap our fingers and give everyone free healthcare and everything works out great? Well, obviously not. Healthcare is an extremely complex system and is going to require a lot of work and discussion to make it function for everyone. But we should approach the problem with the given premise and end goal of guaranteeing access to adequate healthcare for everyone. My guess is that the whole thing will never work as long as the profit incentive reigns supreme. Because profit-based healthcare usually doesn't incentivize good healthcare. No matter how much the government regulates them, insurance and drug companies will continue forever to do whatever they can to screw over the people who need healthcare the most, because that is what will make them the most money. And because healthcare customers are in a compromised position, it is an unbalanced transaction. They're not buying t-shirts or hamburgers, they're buying the drugs that allow them to keep going to work or the procedures that save their lives. You cannot have a fair negotiation with someone who literally holds the things that you need to stay alive. Are there roadblocks for this kind of transition? Of course. Will there be trade-offs and compromises? Probably. You'll notice I consistently use the phrase adequate healthcare rather than amazing top-notch healthcare. And that's because it seems fairly likely that it wouldn't be possible to provide the absolute best possible healthcare with the latest technologies and shortest wait times to every single person in any given country, much less the world. And I also acknowledge that much of the medical innovation that we've seen has happened largely through marketplace incentives. However, I do not believe that that innovation is worth the massive human suffering and death caused by unequal access to healthcare. I believe quite strongly that a cost barrier to healthcare is morally wrong, and this is just another reason why. Sure, markets drive innovation, but working and middle-class people have unequal access to the benefits of that innovation. Are we seriously arguing that it's okay for poor and middle-class people to die so rich people can have good healthcare? That sounds profoundly immoral to me. So if we have to slow down innovation so less people die and suffer because they can't afford healthcare, that's a no-brainer of a choice in my opinion. Even if healthcare was a commodity, human lives and bodies are certainly not, and shouldn't be treated as just another numerical factor in some healthcare market equation. All of our systems should put the rights of people first. I mentioned the fact that in many countries, citizens have the right to an attorney if they're accused of a crime. And in general, no one challenges this right. We generally think it's a good thing. But the situation regarding public defenders isn't pretty. Public defenders don't tend to make a lot of money and are usually overloaded with cases, which usually means they can't spend the time needed to handle cases as well as private lawyers. That said, public defenders still work hard and do their jobs the best they can. And as I mentioned before, this is a right that must be provided to you by someone else. It's not a commodity. And because of that, there is increased demand for the service and undersupply of defenders. There's government regulation surrounding budgets and salaries, and it's rarely the first choice of anyone pursuing a career in law. Now, I'm no expert on how to fix those problems, but I'm not convinced that we're just doomed to have a broken and inefficient system of public defenders. And I certainly would love to see some progress in that area. Nevertheless, no one, as far as I've seen, has proposed eliminating public defenders or the right to an attorney. In spite of these issues, we still hold it as a fundamental right, because that was our premise, that was the goal. And even though it's not perfect, people by and large have access to public defenders when they can't afford attorneys, and it would be way worse if they didn't. And that's how I think we in the United States should approach healthcare. Every other developed country has done it, and maybe they're not perfect systems, although by most measures they seem to be mostly better than what we have here, but by and large, everyone in those countries has equal access to healthcare, and it would be way worse if they didn't. We need to set our goal as free or affordable, universal access to healthcare, and then build around that. Because humans have a right to a basic standard of good health, and this can only be achieved by guaranteeing adequate healthcare to all people. That's just me though. What do you think? Thanks for watching, and thanks to Audible for sponsoring this video. Audible is the leading provider of digital spoken word entertainment. They've got thousands of titles, including audiobooks, podcasts, comedy, and so much more. I know a lot of you have been spending more time at home these days. Well, this is a perfect opportunity to fill yourself with more stories and more information, and Audible is the perfect way to do that. With the membership, you can choose 3 titles every month, 1 audiobook and 2 exclusive Audible originals you can't hear anywhere else. You also get access to guided meditation programs, as well as daily news digests from respected sources like the New York Times and the Wall Street Journal. If you'd like to give it a test run, how about a 30-day trial? Just visit audible.com/T1J or text the code T1J to 500500 and get your first 30 days for free. While making this video, I stumbled upon this audiobook, Health Justice Now, by the healthcare activist Tim Faust. It's a passionate and well-researched takedown of America's dysfunctional healthcare system. I'm a few hours into it, and I found it particularly compelling because the author, Tim Faust, is actually near my age and not some old dude like most of the nonfiction authors I've experienced. And he has the rare mix of justifiable millennial outrage and also undeniable expertise on the subject matter. So check it out, maybe you'll like it. Once again, go to audible.com/T1J or text T1J to 500500 to try out Audible for 30 days, which includes an audiobook and 2 Audible originals absolutely free. And remember, by supporting sponsors like Audible, you not only get access to a great service, you also support me and help me take my content to the next level.